My name is Chris Robinson, and I will be presenting a community analysis of the city of Apopka. During this analysis, I will cover a historical overview, community structure, community population, health-related resources and availability, environmental analysis, government and public policy, and community needs. The city of Apopka is located 12 miles northwest of Orlando, minutes from downtown. As the second largest city in Orange County, Apopka covers roughly 24 square miles. The city started off as a small trade station in northwest Orange County and became incorporated as the town of Apopka City in 1882. It remained town of Apopka City until the early 1900s when it had its official name change. Today, Apopka is home to over 51,000 residents, which has increased from 41,000 in 2010, with an average of 2.94 persons per household. In May of 2018, Apopka had an unemployment rate of 2.9%, with 67.4% of the population greater than the age of 16 employed in the civilian labor force. The City of Apopka is an advocate for the Fair Housing Act, which protects those from discrimination when purchasing or renting a home. In 2017, Apopka had over 16,500 occupied housing units, with 72.6% being owner-occupied and 27.4% being renter-occupied. In addition, Apopka has over 1,800 apartment units. In terms of housing, Apopka does an exceptional job in meeting the community needs based on an occupancy rate of 90% compared to neighboring Orlando with an occupancy rate of 85%. Apopka is home to over 15 schools serving thousands of students in the surrounding areas. There are 8 elementary schools, 5 middle schools, and 2 high schools. 86.1% of persons 25 and older have at least a high school diploma or equivalent, have received an associate's degree, or have attended college. 27.2% of persons 25 and over have received a bachelor's degree or higher. Local community members have voiced their opinions on requesting additional elementary schools to be built in order to remain at par with the growing city population. Established in 1993, Community Redevelopment Agency is located at the center of Apopka and is designed to help Apopka invest in community improvements to downtown Apopka. The areas of redevelopment include a variety of businesses, residences, and historic properties. Changes in building stock, market conditions, demographics, and technological advances are all areas to be addressed. The purpose of a redevelopment plan is to improve quality of life and create economic growth, and increase property values in downtown Apopka. Much of the redevelopment areas will consist of commercial and residential land. Parks, office space, and industrial land comprise the remaining areas to be utilized for redevelopment. Compared to larger neighboring cities such as Orlando, Apopka has a lower educational attainment rate at 86% compared to 90% in Orlando. The percentage of Apopka population between the ages of 18 to 24 who have attained less than high school graduate level of education is 22.4% compared to 13% in the Orlando population. The Apopka population 25 and older with a bachelor's degree or higher is estimated to be 17.3% compared to 23.7% in Orlando. Apopka lacks major universities for local students to obtain higher education. For example, Hair Design Institute is the only degree offering institution in Apopka. Orlando has several colleges and universities, such as Valencia College, University of Florida, Rollins College, and Herzliya University, just to name a few. Non-medical use of prescription drugs has risen to become the leading substances used due to an increase in accessibility. Florida is one of the highest prescribing states of opioid medications, and research has shown that neighboring states to those with the high prescribing rates can provide an alternate method to attaining these drugs. In 2017, there were 6,932 deaths which involved an individual with one or more prescription drugs in their system, which is a rise in 4% compared to the previous year. The most common drugs associated with prescription overdose include methadone, oxycodone, and hydrocodone. Florida is one of the 6 states that declared opioid abuse as a public health emergency in 2017. Advent Health, Apopka, formerly Florida Hospital Apopka, has provided the Apopka community with whole person care since 1967 and has recently relocated and opened a new hospital facility in South Apopka. The hospital provides treatment as well as cardiovascular, diabetes, digestive, pulmonary, surgical, and rehab care, as well as imaging services and general surgery. Financial assistance is available to those receiving non-emergent hospital services and are not covered by any form of insurance or federal program. CareSpot is an urgent care center that serves as a walk-in alternative for same-day health care and more affordable than going to the ER. Services offered include x-rays, wellness checks, immunizations, lab tests, infection treatment, and sprains. Most insurance plans are accepted as well as major credit cards. Financial assistance is not available. The CVS Minute Clinic is staffed by nurse practitioners and PAs who are able to write prescriptions, treat minor illnesses and injuries, perform screenings and monitorings, administer injections and vaccinations, and offer physicals. The hours are typically shorter on weekends compared to urgent care centers, and most insurances are accepted. Walk-ins are also accepted. 3 community objectives based on topic areas of Healthy People 2020 were selected specific to the Apopka community. Substance Abuse Objective SA13 aims to reduce past month use of illicit substances in adults 18 and over. Objective HDS2 aims to reduce coronary heart disease deaths. Objective TU 2.2 aims to reduce the use of cigarettes by adolescents over the past month. The City of Apopka aims to provide a variety of wholesome, innovative, and various recreational programs, activities, and facilities that will enrich the lives of those in Apopka. There is a benefit of increasing physical activity in that it may delay or prevent metabolic complications such as type 2 diabetes, cardiovascular disease, and hypertension. Physical activity has been shown to increase bone mineral density, increase school performance, and have a positive effect on mental health. The City of Apopka sources their drinking water from the Floridan Aquifer, which is fed by rainwater that filters through hundreds of feet of sand and rock. The Apopka City and Orange County also utilize automated curbside collection programs. This program provides residents with 2 roll carts for garbage and recycling. Offering residents recycle carts can eliminate the burden of having to locate and transport facilities to drop off recyclable items and reduce the amount of garbage in the recycling stream. Apopka has 5 elected officials, including Mayor Brian Nelson and 4 city commissioners. Each official serves a 4-year term and is elected by the registered voters of the city. Council meetings are held on the first Wednesday of each month at 1:30 p.m. and the third Wednesday of each month at 7 p.m. Officials are available at the downtown office and may be reached via email. The City Administrator and Finance Department proposed an annual operating budget for the fiscal year. The proposed budget for the 2019 fiscal year has decreased 8% compared to 2018 budget, but includes funding for several areas such as school resource officers and 6 new police vehicles and other key city positions. Access to care is a highly prioritized community need because it is essential for promoting and maintaining health, as well as preventing and managing disease. In Apopka, 15.5% of the population under the age of 65 is without health insurance. There is an increased need for community-based education to prevent injury and improve health. The Florida Department of Health in Orange County can provide educational materials and participate in events that promote community health. Poverty also continues to remain a prevalent issue in many areas of Apopka. 10.6% of individuals are reported to fall at or below the poverty level, making it difficult to afford health care, pay bills, and afford housing. Apopka currently has only one community health center to service the needs of uninsured and underinsured children and adults. Affordable services are offered to patients regardless of insurance status. The percentage of individuals 25 and older with a high school diploma or higher is 86.1% in Apopka, compared to 94.6% in neighboring Altamont or 91% in neighboring Orlando. High school graduation rates are often seen as an indicator of the skill level for the future workforce. The Bureau of Labor Statistics revealed that in 2017, full-time workers ages 25 and older with a high school diploma had higher weekly earnings compared to those without a high school diploma. The final community need in Apopka will be the need for additional universities. Currently, there is only one university in Apopka, which is the Hair Design Institute. Having another institution which offers various degree programs would be beneficial to the local community. Surrounding areas have universities and colleges, which include Valencia College, Rollins College, Seminole State College, Full Sail University, Everest University, University Technical Institute, and the University of Central Florida.